So this clip's going to be about something that a lot of you are concerned about, and it's being induced. Routinely in Cardiff and Vale, we set a date for induction about day 12 or day 13 after your due date, so you're nearly 2 weeks overdue. Your due date is an estimated due date, it's not written in stone. We know that theoretically that babies who are more than 42 weeks of gestation are sometimes more likely to encounter fetal distress when you're in labour, so the thought is to induce you a little bit before then. We also know that the majority of babies are born in that period of time between your due date and 41 weeks, so we give your body plenty of time to go into labour itself. You'll see your midwife routinely at the 40-week appointment, and we'll make an appointment for you usually when you're about 41 weeks to talk about what you want to do, and more often than not we'll offer a stretch and sweep at 41 weeks. And a stretch and sweep is a way of stirring things up a bit. It involves a vaginal examination. It's your midwife doing let's go back a couple of pages, vaginal examination to the cervix, to dilate the cervix. Let's get it back a bit more, here, to dilate the cervix and to sweep around the membranes. It shouldn't be painful, but it might be a bit uncomfortable. It can be done in the doctor's surgery when you see your midwife. At the moment we're making appointments for women to be seen at Llandoch Hospital with your community midwife, but at Llandoch Hospital. And I know the Heath girls are doing the same thing as well. As for the rest of Wales, I'm not too sure. So at that appointment, 41 weeks, we would book you to be induced, and that would be in the hospital. They would phone you on the day that you're due to be induced. Hopefully you've gone into labour and got your baby in your arms already. But if you haven't, you'd be given a time to attend the hospital so that everyone doesn't arrive together. Certainly at the moment with COVID-19, they'd want you all to be arriving separately. Depending on what your cervix is doing, if it's like this, that's good. That means your body's thought a bit about labour. If your cervix is long and more or less shut, like here, what they'll probably do is insert something called a propes pessary, which is the size of your little fingernail. It's got a thread to it, and it's inserted into the posterior fornix at the back of the cervix here. Now this has synthetic prostaglandin hormones in it. It's left in for 24 hours. You're an inpatient at this time for that. So your partner can't stay with you at the moment, okay? So he or she has to go home. So you're an inpatient. If labour starts within that time, then your partner comes back in. If it doesn't, and 24 hours later you've had maybe a few niggles, you might have had a show, but you're not in labour, another vaginal assessment is done, and a gel is inserted of the same stuff, so prostaglandin synthetic hormone, but in a syringe in a gel form, and it's inserted into the same place right at the back end of the cervix here, and you can have 3 doses of that every 6 hours. So it can be a bit of a long time when you're getting induced, so you can come in the morning and people think they're going to have a baby within a few hours, which some do, but it might take a day or 2 to actually get you into labour. If you're not in labour, after the 3rd prostaglandin gel, you have a powwow with your midwife and your doctor that's in the hospital, and a discussion is made, sometimes a day's rest, and then start the whole proceeding again. Or sometimes the decision might be made to go for a sort of elective caesarean, but that's, not the usual. Usually women who are overdue will be going into labour at some point along that process. If after maybe the 24-hour process or one of the doses of the gel, your cervix is open enough, no, not that one, over again, open enough for them to break your waters, that might just get you into labour again. So if your neck of the womb's open just a little bit here, they would use something like this, which is a long, like sort of crochet hook type thing with a little sharp bit on the end here. It's long because of where it has to go. So again, vaginal examination. There's no getting away from these vaginal examinations, unfortunately. Insert it into the vagina, and then it just nicks the bag of water there, and then you just feel like a wetness. And this is usually performed up on labour ward, or sometimes on the induction ward, just depending how low down your baby's head is. Usually you'd be given an hour or 2 then to get up and mobilise. So that cushion has gone now, hard baby's head pressing on the cervix, and hopefully your contractions would start, or at least have the good grace to join in and get you into labour. If it's still a slow process and things aren't budging and you've had your waters broken, you've had your Propess pessary, you've had the gel, and still this lovely little baby is in there and you're not contracting regularly and strongly, you'll be up on labour ward by now and they'll be talking about the drip. So if you've talked to friends or family and they said, oh, I had to have the drip, this is what they're referring to. So the drip is a Venflon, a bag of synthetic prostaglandins called syntocinon, and it's inserted through a giving set into your Venflon, straight into the vein, and a little pump that measures very accurately how much of the syntocinon you're going to be getting. The dose gets increased every half an hour or so. Your contractions are closely monitored, your baby's heartbeat is closely monitored. It's a drug that you're having straight into your veins, so you both have to be monitored closely. The idea is that this usually very efficiently will get your contractions coming so that you're having regular painful contractions every 3 minutes. So you're having 3 or 4 contractions within a 10-minute period. The idea then being that that's you getting into labour. So you would be examined every couple of hours then if you had the drip. Most women, if they're having the syntocinon drip, may well think that they need to have an epidural for this. You don't need to jump straight into having an epidural. You might start off with some pethidine, but a lot of the time women would have an epidural if they were having a syntocinon drip. So it's something to very much consider if your induction process is taking a long time and they're talking about the syntocinon drip. The syntocinon drip can also be used if you're in labour and things slow down or stop. Remember, as we've said a couple of videos ago, that ideally the neck of the womb dilates at half to 1 centimetre an hour, and we examine you every 4 hours. If you don't reach that speed of dilation, we might break your waters to see if that encourages the cervix to open a bit more, and if that doesn't, then the syntocinon drip is considered to hopefully speed up your contractions. Likewise, if you've got a baby that's been in a bit of an inconvenient position, he or she has been back to back and is rotating round, and your contractions just don't seem to have the welly to get him right round so that you can start pushing him out. Sometimes the syntocinon drip will just give your contractions a bit more oomph, just to help him rotate, because he'll rotate by not only the strength of the contractions, but as the head hits the pelvic floor here, and that firmness will just give him something to rotate on so that he can come round, okay? So it has lots of uses, the drip, so, but it can be very painful and intense, so that's why an epidural is something very worthwhile considering, okay, if you get to that stage. So I think we'll call that a day for now, and then we'll go on to if there's any more complications. And now, and I can find my mouse just to turn it off. Oh my God.